introduce to you Autofocus Pro, a unique and novel ringless polyfocal progressive IOL which gives excellent vision at all distances, far, near and intermediate, without haze, halos and starburst, which is completely free from negative dysphotopsia. Autofocus Pro looks almost like a monofocal but works like a multifocal. Very polyfocal progressive lens bag, there is no mechanical pseudo accommodation, but yet it functions like an autofocus lens and hence the name. Progressiveness of this IOL is visible on NIDEC OPD scan, which is much similar to varifocal lenses. This OPD scan nicely illustrates the wonderful progressiveness of this IOL with distance dominance in central area of photopic pupil. This is the sketch of design and dimensions. This is the schematic optic of autofocus progressive polyfocal optic, which gives excellent DIN vision, that is distance intermediate and near, by green technology, that is gradient refractive index. As you can notice, there is no loss of light energy because there are no diffractive rings, so there are no photons which are lost. This is the schematic optic, and as you can notice that even with different sizes of pupil, the ratio of the distribution of light remains the same. These two dialing holes are also position indicators to be kept in upper half of eye. They also help to drain out any remaining retro-IOL viscoelastic. Undulated haptics are inspired from postal stamps border. Undulated haptics are achromatic like fist knuckles or custard apple surface. Large and horizontally oval optic covers full visual field, hence there is no negative dysphotopsia. And 6 mm long L-shaped zigzag-edged haptics provide rock-solid rotational stability. Autofocus Pro is available as both versions, hydrophilic, non-preloaded with disposable injector and cartridge, which are in the box, and also as hydrophobic preloaded with push or screw dual mechanism injector. This silky, smooth and soft IOLs injection is very easy, as good as any other soft foldable IOL. And as you can notice, unfolding is gentle and slow, and once both haptics are in the bag, we have to rotate the IOL so as to keep both dialing holes in upper half of eye, keeping the IOL horizontal as best as possible. At any size of pupil, light distribution proportion remains the same, hence it is pupil independent. There is no light energy loss because there is no destructive interference or diffraction, and angle kappa or angle alpha are of no significance nor of importance. In this retroillumination, we can barely perceive the different zones of Autofocus Pro IOL. This is the only ringless progressive IOL having all zones in central 0.9 mm area, and hence it is independent of any pupil size. This is the typical post-op fogging over refraction chart, and as we can see that from +2 to -4, the vision remains almost the same, which is almost like 6 diopters of amplitude of pseudo accommodation. This is the typical DOF chart of Autofocus Pro, which is almost flat from +2 to -4, which is nearly identical to a teenager's natural lens DOF. Autofocus Pro is a forgiving IOL for post-op refractive surprises from +1 to -1 diopters. Don't worry, it will auto-balance itself. Contrast sensitivity is as good as a young adolescent as measured on Pelly-Robson chart. Any patient with clear cornea and healthy macula is fit for this Autofocus Pro lens. Autofocus Pro, although being a progressive multifocal, has MTF value of 0.65 for distance, 0.4 for near, at 3 mm pupil size, at 50 lines per minute, and thus IQ, the image quality at retina and contrast are as good as a monofocal IOL. With crisp and clear vision at all distances, without any negative or positive dysphotopsia. Autofocus Pro is also a presbyopia correcting IOL. All near vision intensive vocations become spectacle free and as easy and as clear as a teenager. Out of 11,000 plus implanted, not a single patient complained of negative dysphotopsia because Autofocus Pro IOL is semi-oval with 7.5 mm horizontal and 6.3 mm vertical diameter. Conventional 6 mm optic IOLs give rise to negative dysphotopsia due to this gap. Autofocus Pro gives panoramic vision without black borders being seen and without the blurred peripheral aphakic vision. Autofocus Pro IOL is large enough to cover entire pupil even in traumatic mydriasis, hence there is no negative dysphotopsia. Beyond cataracts, it is also the best choice for surgical treatment of presbyopia, high hyperopia and high myopia. It is also the best method to treat narrow angle glaucomas. There is no need for mono, micromono or mix and match vision. Autofocus Pro is also the best choice for kids. These children will need only monofocal spectacles to correct the gradually increasing myopia. They will never need bifocal or progressive spectacles, which is a big recurring expense for parents for over 2 decades. And there is no waxy or hazy vision, so no induction of mild amblyopia. Phaco or MSICS, Autofocus Pro is the best choice IOL. Autofocus HR is our 9 mm optic foldable and 3.5 mm incision injectable lens. The suffix HR stands not only for high resolution but mainly it is to commemorate Sir Harold Ridley. And we are already in the process to introduce Autofocus Krista, which is the world's first non-foldable PMMA low-cost autofocus lens made mainly for MSICS surgeons. We have already completed the clinical trial and we are in DCGR clearance process at the moment. To conclude, all other IOLs are gems, but Autofocus Pro is the jewel of the crown. Thank you very much for your kind attention and patient listening. Thank you,
I
sir.
think I think you have adopted the same technology which has been used by VVTT.
No, sir. VVT has a ring. It's different. It is having a ring, and this is very similar to our progressive spectacles. So when you look at the lens, you don't see anything. You feel as if it's a monofocal. You might get confused that whether this is a progressive lens or a monofocal.
My point was related to the basic technology which you are using, gradient refractive technology.
Right.
And it's good that you have reached to that point of gradient GR technology by which you are able to elongate your focus. But how have you been able to achieve it? That is the question.
Yeah, that's very interesting. When we make the button, the button is made out of two polymers. One polymer is having refractive index of 1.4. The second polymer is having refractive index of 1.54, and the optical density increases from top to bottom, and that's how there is a stepless progression.
So, but that means the interference you're generating is by producing a difference in refractive index.
Right.
And what VT has done is by producing a different surface. So, phase difference has been created. I understood it only yesterday, so I'm quite fresh.
Right.
Many people will find it difficult. It's interesting for general understanding is that usually we talk about point focus, and here we are not discussing point focus. We are discussing the stretch of focus. Huh? So I think they have also taken up that point. The only thing which they have done is by mixing the refractive index alteration. So the interference that they are able to generate is by using that. That's a concept, I think.
Yeah. So
and it's
so
a reasonably good concept.
Yeah. Right. Thank you.
Dr. Moria said he will give me a few lenses for trial, and he has left. So just remind him that he will.
I will remind him. Sure.
And where it is available and what's the cost?
There are two versions. The hydrophilic version is 8,000 plus GST, and hydrophobic version is 12,500 plus GST. the preloaded.
And where it is available?
It's manufactured by Lifeline, and they have distributors all over the India. And I'll get in touch with Dr. Moria and make sure that you get the
I get it.
you get the
Okay, I'll
lenses.
try and
Right,
get
right.
back to you.
Thank you, sir.
So I think it was a nice session. Thank you.